Okay, so our presentation was on AAC assessment and treatment for a patient with post-left CVA. Our patient is Tom. He's a 52-year-old male who is an attorney. He likes to hike and be outdoors, and he's also married with 3 children. He suffered from a left cerebrovascular accident. What is a left cerebrovascular accident? It is also known as a left-sided stroke. A stroke is caused by a blockage of blood vessels in the brain or by bleeding in or around the brain. Patients who suffered a stroke typically exhibit physical, sensory, communication, cognitive, and emotional deficits. Tom was administered the following assessments after his stroke: an oral mech exam, the Western Aphasia Battery, and a quality of life assessment, which assesses the quality of communication the patient exhibits. The assessment looks at the impact of the disorder on relationships, interactions, work, and social life, and overall quality of the patient's life.
So after the assessment, Tom's diagnosis is non-fluent aphasia, and he suffered the LCVA stroke on January 10th, 2016. He has severe impairments in both receptive and expressive language, and he also suffers from right-sided weakness. Tom has been seeing a speech therapist since his accident, and he also receives occupational and physical therapy. And it's also important to keep in mind that patients with aphasia have difficulty with speaking, listening, reading, and sometimes writing. Tom's personal goals include him being able to communicate with his family members again. He wants to begin working again as an attorney. He also wants to be able to hike. And based on Tom's personal goals, an AAC device is recommended. So for the AAC assessment, it's important to assess the language and communication. So that would include assessing receptive, expressive, and other general communication skills. Symbol assessment, which evaluates the patient's ability to identify symbols and to navigate and access well with the AAC device. So it's important to look at both gross and fine motor skills as well as the patient's hearing and vision. Device trials, so it's important to trial different modalities of AAC, and therefore you would evaluate over an extended period of time. That can either be rented or borrowed from the AAC manufacturer. Access methods, so it's important to assess either message selection for those who cannot direct select with their fingers. So examples of those selections would include either scanning or encoding, or you could also choose a specific switch, or also either the head or eye tracking devices. And it's also important for access methods to coincide with an occupational therapist for the best option for the patient. Multi-model approach, to identify multiple strategies to maximize the patient's level of communication. So you would either decide on a high-tech or a low-tech device. AAC instruction to the caregiver and family. It's important to make sure that the caregiver, spouses, and the family are involved with the assessment process to decide on the best device for the patient. It's also important to teach the family members or caregiver how to use the AAC device. And finally, personalization. So it's important to create a communication tool that is specific to the patient. So for Tom, we would have specific symbols that are tailored to him. So that would include his family members or outdoor activities, for example, and also include all information learned from the assessment to personalize his AAC device. So for Tom's therapy goals, for his long-term goal, Tom will express functional wants and needs at the basic communication level through multiple modalities: AAC, verbal expression, and gestural expression with 70% accuracy with moderate cueing. For short-term goals, Tom will express relevant personal information, so for example, first and last name or wife name, with maximal tactile, visual, and verbal cues with 80% accuracy. And Tom will identify symbols on the AAC device to express basic wants and needs with moderate cueing with 80% accuracy.
Based on the AAC assessment and Tom's current level of functioning and his communication needs, he has recommended the Tobii Dynavox T10. This device is a powerful touch-based, tablet-like speech-generating device for communication when you need it. The device is high-tech, touchscreen, lightweight. It weighs 1.9 pounds, so it's easily portable, and it has embedded speakers, which it can be heard anytime, anywhere. Treatment for Tom. So we will work on his short-term goals with AAC as well as his long-term goals. He will also see an occupational therapist to work on his fine motor and gross motor skills to enhance device use. We will also work with Tom's wife to train her with communication strategies and goals for AAC use at home for generalization. And also practice using verbal output from the AAC device as a model. Videos are included in the device to practice phonemic production or commonly used phrases. It is also important to train Tom's wife. Some goals for Tom's wife can be to change behavioral interactions with her husband, give appropriate time for response, and ask open-ended questions. For example, what do you want to drink instead of do you want coffee? To support our choice of using an AAC device for Tom, we looked at the following research articles. The first article is Functional Communication in Individuals with Chronic Severe Aphasia Using Augmentative Communication. This article looked at augmentative and alternative communication for adults with aphasia. The article found that there was improvement in the quality and effectiveness for all individuals with aphasia. The second article looked at high-tech AAC and severe aphasia for patients using the touch-speak device. The article looked at the effectiveness of augmentative and alternative communication for individuals with severe aphasia. The article found that 5 individuals were extensive users, 5 were independent users, 5 were partner-dependent users, and 13 individuals had no functional use of an AAC device. This article provides an accurate representation of AAC and severe aphasia. AAC can be effective for individuals with aphasia. However, that is dependent on the person and their communication needs, willingness, and parent and family involvement. AAC may not be the best option for every individual with severe aphasia. And the following is our references that we used.